I think the rough timeline only will depend on largely the COVID cases that we face in our state. Even today, as we speak, we are, of course, trying to ramp up our testing since testing is absolutely voluntary and people can test at whatever point they want to. And we're trying to be transparent and we're wanting everyone to come up and test. I think the most crucial point would be the first priority and the first parameter for opening up, which will be slow, which will be staggered, is and it is only and only going to be the amount of COVID cases that we get. So our first priority is health and safety, and that's what we're looking at. Of course, even the lockdown today, if you see, is quite calibrated. Our essential offices are on, our manufacturing services are on, exports and imports are on. So it's very, very calibrated. Having said that, when you can step out for non-essential activities would only depend on the caseload.
Right. Aditya, let's talk about the vaccination plan for your state. And that's, I know, one of your top priorities as well, aside of handling the pandemic and the virus count. We are given to understand, and news that just came out this morning, President Joe Biden is allowing exports of 20 million doses of either Pfizer, Moderna or J&J vaccines out of the U.S., in addition to the 60 million doses of AstraZeneca vaccines pledged earlier. Are you part of the deal since you're seeking global supplies?
We are seeking global supplies. We floated a global tender, and not just us, there's Mumbai, there's Pune, a couple of cities across India and a couple of states as well. Since now the procurement of vaccines has been deregulated for at least 50% of the stocks across the country. Having said that, we are, yes, of course, trying to get as many vaccines as possible for our state. We have a population of 120 million, and our firm belief and the medical belief in the state is, if we want to prevent a third wave, which is, we see a possibility around September, October, we have to vaccinate as many people as we can and protect them. So that is the intention. So we would want to procure globally from wherever we can.
And Minister, I'm just wondering, once you do receive these supplies, hopefully from the U.S. and other places, I mean, what are the challenges involved in actually distributing them? Because we understand it's one thing to be a recipient of extra vaccine doses, but actually getting them into the arms of individuals is another task.
So Maharashtra as a state has been one of the fastest states to vaccinate the people in terms of the supplies that we are getting. One of the days, I think about 2 weeks ago, when we had adequate supplies coming in from the government, we vaccinated about 500,000 people in a day. As of today, we've vaccinated about 20 million population as of yesterday. But the point really is that in terms of planning, in terms of setting up the vaccination routes, almost everything is in place. All we're waiting for is enough supplies. The good part about the vaccination drive is there was a certain hesitancy in the earlier days about the vaccine. That's gone away. A lot of people are wanting to take the vaccines. A lot of young people are wanting to take the vaccines and get back to normal, whatever the new normal would be. But they're wanting to step out with a sense of security that they're protected against the virus with the vaccination. So I think the biggest challenges as of today, the biggest challenge rather, is procuring the vaccine or getting the vaccine in terms of a larger quantity as much as we can for a state. Beyond that, the ground systems are pretty much in place. Of course, going into the rural areas, vaccinating the population, or going into densely populated areas and vaccinating the people would be one of the logistical challenges that we are trying to prepare for, and that would be in place as soon as possible.